which is in connection with our digestive system.
Okay.
Smile. Thank you, ma'am. Smile.
Sorry,
Well.
sorry,
No
sorry
problem.
for
No
this delay.
problem.
Sorry. Now we can start. Smile evening. So we will start now. Last time we had discussion on digestive system, and we try to understand that how this digestive system is working and how much important is this digestive system in our body. And if we take care, as I told you last time we discussed that this is very beautiful God's mechanism, and if we don't interfere in this mechanism, our digestive system will work very beautifully. Since our birth until now, our digestive system is working non-stop, non-stop for us. It is very delicate. At the same time, it is working very hard and it is doing wondrous job. So this system, before we do practical, I want to convey 2 points that is very, very important. Until and unless you bring change in your lifestyle pattern, we cannot recover fully. So we need to bring change in our lifestyle, as I discussed in my last class, that what steps you should take in bringing change in your lifestyle. Yes, and in this lifestyle, our main important point is that you have to keep your mind relaxed and free from stress. So this is very important because especially if you will do survey on people who have digestive issues, you will find in them that anxiety and agony, worries are very dominant features. People, those who have worries, anxiety, more often they suffer some or the other problem of digestive system. So you have to be aware, and if we are aware of our lifestyle and if we take dedicated steps to bring change in our life, definitely we will never fall sick. So now I want to focus practical part today. My main purpose is not to talk theories. I want to teach all how you will do treatment, and I will focus all points minutely. So because I assume that you have seen previous recordings and I don't need to focus all those theory related points. So digestive system, when we talk about digestive system, it is starting from mouth and then it is ending in the anus, mouth to anus. Yes. And we reached until stomach. And in next series also, we will study digestive system and we will try to complete all organs and how to treat. So first thing is mouth. Mouth is very important point. And your mouth is doing multi-dimensional works. Lot of works, mouth has very high status. Sometimes we ignore, though we generally, when we talk about systems like nervous system, circulatory system, digestive system. So when we talk about systems, so systems, I will show, don't worry, there is message in the chat box. Kindly use the slides. Today I will show practical lively on my hand and I will share my camera. Don't worry, because theory part you have done in last class. So mouth is very important part of our digestive system. As I told you that we talk about systems like nervous system, circulatory system, yes, and respiratory systems. But mouth is very small part of digestive system, yet it is where it has highest level of value, highest level value. So what all functions you do with the mouth? Oh, there is a message, low voice. Is my voice clear? Please let me know.
Yes, ma'am, it is very clear. Very much audible. Thank you.
Okay. So mouth is participating in eating, tasting, smiling. Yes. So mouth is and the most important work mouth is doing is smile. Mouth is part of digestive system, but at the same time it is participating. It has very high level of value because it is participating in smile, and also it is we are using this mouth for speaking. It is not just digestive system. Yes. So this mouth is very, very essential. Can you imagine when you have toothache and how your mouth looks like? So smile is very important. If your mouth is healthy, your smile expression is also very good. So person having teeth problem, tongue problem, liver problem, oh sorry, lips, teeth, tongue, upper palate, yes, any problem in the mouth, then if we do Sujok therapy correctly, definitely you will observe the result. Okay, so now I want to share my screen and we will do practical. Okay. So you can see now. So first thing is, before I show practical, last time we saw the points of the mouth. So in mouth, animal head system is considered as most important system for treating mouth diseases. Yes, so we saw this last time also. Then you can see when you bend your thumb, then area this complete area is representing your mouth. So in Sujok system we have main system, human system. In basic system, we have human head system, and also we have uh, animal head system. Let me concentrate. Okay. And this system, this animal head system, is considered the most important system for treating all mouth diseases. Yes. Now, see. First, you can see this picture now. After seeing this picture, we will see on the hand. So we will focus how to treat teeth, tongue disease, yes, lips disease, and also taste, loss of taste. So see, face, this is face, nose, yes, and this is your mouth territory. Okay, now if person has any, first we'll talk about toothache. Immediately you will experience the result. So you see, this is the mouth area, this nail, around the nail, this is the mouth area. Yes, this is lip and jaw, teeth. So this is complete, this nail is representing the mouth, and here in root area, this is lip, jaw, and teeth. So first we should know how to locate right, left and right jaw, up, left upper, left lower, right upper, right lower. So you see, you just keep the thumb in front of your head like this. So you see, this is my right face, same. Here is your right. You see, I'm keeping just like this. For example, you see, this is my face, and this becomes also my right side. Okay, so you see. So this, imagine that this thumb is just in front of my face. Okay, so this becomes your right. This side is your right, and this side is your left. Now I'm finding these points on the left hand. This is my left hand, and bend your thumb in this position. This is your right, and this is your left. Why I'm focusing right and left more? Because if person has a right toothache, and if he is doing on the left side, he will not get the result. That is why right and left, this is very, very important. Now, How to search? You see, this white line, this is all your points of teeth and jaw. So like this, you have to press. Now, when you're searching the point for the toothache, I want to tell you that this area is very, very sensitive. Even you press little, patient will have pain. So you have to keep this thing in your mind that this is very sensitive area. So, so don't press very deep, little pressure. And if patient gets very strange, sharp pain, even with the gentle pressure, then this is the right point. So now a case is that patient has right upper teeth. Now we have 32 teeth. Yes, this is general 32 teeth. We have people have also 28, 29, but 32 is the common number. So what we need to do that we divide this into like this 8, 8, 8, 8, 8, 8. Yes. So this way you can see I'm keeping my thumb like this. You can just match. Then this side is left. This side is your right. Yes. So now we don't need to find exact tooth. You just need to find upper or lower. So this is right upper. This is right upper jaw, right lower jaw, left upper jaw, and left lower jaw. Okay. Now, if person has right upper jaw, any problem, whether it is this one or this teeth like this tooth, no problem, because in hand this is very small area. So you just need to go just this quarter sector, yes, among this 4. So now you see like this, I'm searching. And if I get very strange point, then I can put a mark with the pen. For example, I got pain here. I'll put a mark here and then press this point. Press this point. And stay there before you fix the seat. Yes, to get the relief, just stay there and release. So this is one way to do massage. There are various ways to do massage. So this is one way. See, like this. And second way is rolling massage on that point. And you continue this massage till the time patient says, yes, I'm getting better. I got relief. Yes, if your point is correct, immediately patient will get relief, immediately. Then when patient says that I have relief, then second step is that you will tie seat. So I'm using this paper tape. And I will fix fenugreek seed, 3 seeds. So the center seed will focus the main point. For example, this is the main point. Then after massaging, I will fix this seed like this. Like this. And then I will tell patient to, I will do press. And when my treatment is finished, then I will tell patient to press this point more often. Yes. And then he should keep in between, he should press from time to time. And then he should keep this these seats for at least 8 hours like this for full recovery. Sometimes you will notice, patient will notice that in 1 minute pain goes. Yes, sometimes 10 minutes, 1 minute, but most of the time we have observed if point is correctly found, then patient will get relief in one sitting only. Okay, so this is how you have to treat. So now if person has lower teeth problem, then you have to search here. You see this picture, try to understand this picture. Then if person has this area problem, yes, this area problem, this is left lower, this is right lower, this is left upper. So accordingly, you will search the point. So this demo will help you to understand all the areas of this teeth. You see, now another case is that tongue tongue problem. Okay, let us first do some jaw problem. Sometimes patient has loose teeth and gums are deteriorating like this. For gum disease also, this is the area. Yes, so you have to massage this area nicely because this is a very sensitive area. So massage this area nicely. If person has any gum disease, you should massage like this. Yes, like this, because ring massage cannot massage this area. So very good to massage with the help of probe. If you don't have this probe, then you can use, as I told you, back side of toothpick also you can use. Now, one more important thing I want to tell you, that if person has some uh, loose teeth, yes, loose teeth, then or gums are deteriorating, then very good to do moxa therapy. Then how to do moxa therapy, I will tell you. This is very important. You can experience very good result if you really do it for a few days, like shaking, teeth shaking. Yes, teeth is shaking and gums are deteriorating. So for this, we are using this moxa. See, this is candle. We burn this moxa, and this moxa, yes, this moxa is good for all chronic diseases, all chronic diseases. So we need to burn this moxa. So initially it takes time. Because this moxa is very important tool in our treatment system, especially for all chronic cases. Even in chronic stomach disease, chronic esophagus disease, this is very important tool. We can check. Yes. And you see, slowly, slowly, and don't bring so close, don't go very far from the skin. Patient should feel good warmth. Yes, you will see within 4 days, you will see the result. And for all chronic cases, at least you should do 15 days thoroughly without any pause. You can do for 15 days moxa for 5 to 7 minutes. Each time you do like this, you see, feel the warmth. This is for loose teeth and gums deterioration, chronic disease of gums. And this moxa we will use, like now you have seen how I burned the moxa. So this moxa we will use in chronic stomach diseases and chronic esophagus diseases also. Yes, and this is how you have to quench this moxa. Just dip and see. And then because this person has loose teeth, because previous case was just one toothache problem. So now this person has a loose teeth, so better we tie seeds around the this jaw area. Just see, you should have good seed box. For 15 days continuously, you see how I'm fixing the seeds around the nail. Side also. And this is how you will cover this area. This is round area. And then press. This pattern you have to do for 15 days, and then you can give a pause and you can see how it is improving. So if you see that this method is really improving, and I'm sure that gums situation will improve for sure. And then if you see that little percentage is left, then you can continue this treatment. And also one more point I want to say, that one day you do it on the left hand, second day you do it on the right hand, so that skin will get rest. Okay, so this is how you have to do this teeth. Yes, then also I want to show that in human head. Yes, this is very simple. We have mouth here. Okay, so we have another point. So this for teeth, I like this area around the nail is very good. So for tongue, you can stimulate this area. Yes, for if person has tongue blisters. Yes, if person has tongue blisters and some red color, some acute disease like this, you can apply dark blue color also here in the mouth area. In one hand thumb you apply dark blue color, and on the other hand you can apply the seeds. So now you have, if person has any here also you can find the jaw problem or teeth problem, but tongue problem, this is very good area. For teeth you should treat here. Okay, and if tongue blisters, tongue problem, so after doing a massage in this area, yes, try to find the painful point here. And then this is very important, finding painful point is very important. Then again, for tongue disease, any disease in the tongue, 4 seeds. This is green lentil. So white, the eye of this seed, white dot of the seed will touch the skin. All tongue diseases, yes, like this, after doing good massage. you will fix here like this. Okay. This is for tongue disease. In one hand, you can apply color, and on the other hand, you can apply seeds. Then also a speech problem. This point is very important in emergency if patient loses the speech. One point, very effective. We can see here this point. So this point here is very, very effective in thumb area. So this one. Yes, you can see the mark. Okay. So in emergency, loss of speech, thumb top point, you press this area, little deep and pause. Press and pause. Also, you can check if this point in the right thumb, the point is painful, then you can treat that point. Yes, like this. And then you can put black pepper here. Sometimes in some tragic situation, person loses his speech. See, like this. Just one point. So I put seed here in this area. Yes. And then next, I want to focus this point now. You have studied in last lecture that for mouth diseases, this finger has a very special role. Now, because I will tell from all point of view, we have correspondence system, we have Triorigin treatment, we have 6 key treatment. According to the level of your consciousness, you can use any pattern. All are very good. It depends from person to person. Some people, they like, some participants like Triorigin very much. Their consciousness is very well aligned with the Triorigin, so they can do this tip very easily. So this hand, in this hand, especially right hand, yes, especially in right hand, we have very effective point in for mouth diseases. So now I told you last time, this right thumb, upper joint, and this side point. So we need to press this point first, and we should put one fenugreek seed first. See this thumb and here. First seed to open mouth territory. This is the window to open mouth territory. Outer point, this one. So I should do it on right hand. Right hand. So this is the area you should stimulate. Massage 1, 2, 3, 4, and 1 fenugreek seed on this area. This point, massaging this point, will open your mouth territory on the right hand middle finger. So this finger will become sensitive for receiving mouth treatment. This point, that is why this one small, don't underestimate the power of this one small seed. So after you put one small seed, this finger sense will become very sensitive for mouth. Yes. So now you see this joint, as you see in this picture, this joint is representing lips. Any lip disease we will treat here. Okay. For example, patient has dry lips. Patient has dry lips, cracked lips, red lips, swollen lips sometimes. Yes. Dry lips in winter season, generally everyone has. This is normal, but even in the summers, even after applying, even after taking best care, and after applying good cream, then also dryness is there. Then this has deeper connection. This is lip dry is not superficial. Some problem is inside, and the expression has come on the lips. So this joint will heal the root also. This is very special Triorigin joint. You will see the miraculous result after treating this joint. So now, first you can do very simple technique is color therapy. You can, I will tell you, blue color. Yes. So if you see any lip, cracked lip, very dry lip, this color you can apply on this joint and you can make a ring. Now I'm not coloring my joint because I have to show many practicals. So you just color it and you see the change. After 1 hour, you will see the change. And you should continue this because if it is chronic problem, any chronic problem, please do treatment at least for 2 weeks regularly. Okay, then you can have a pause, and then if you need more, you can continue till the time disease is fully cured. So this is how you can do blue color for all cracked problem. Yes, to dry lips, you can do swollen lips, you can do like this. And also seeds, you can find the painful point, you can do correspondent treatment also. Yes, one by one you can check, one by one, all points you can check. Some people, they are very, very happy with colors, their color consciousness is very good. So all treatment are good. You can choose anyone. You should know how to find the correct pain point. In previous lectures, I have explained how to find the correct point like this. And wherever you get painful point, you can check back, you can check front. Yes. And there you can mark and apply the seed. In case you get multiple points or you don't get painful point, then another technique is that you apply seeds on 4 direction. Again, this is right hand, middle finger, this joint just below the nail area. This is corresponding to your lips. You can see the result. Sometimes in few minutes, you can see the result. So 4 fenugreek seeds, 4 direction of this joint, center. So we will apply here. See, I'm marking for you because after putting tape, you cannot see. 1 seed here, 1 seed here, 1 here, 4 direction. Okay. So we will fix this on 4 direction. Just this one, you see. So you have done first step here. First seed is here. This is first seed. Okay. And then this is your second step. So what you can do if you want to combine color therapy and seed therapy, then for example, in daytime, you can do color therapy, and in evening time, sunset time, you can do seed therapy. Make sure that you remove color after 2 hours. Yes, after 2 hours. Sometimes we can keep for 4 hours, but for beginners initially, I advise to do just keep for 2 hours, and make sure you remove this color. Okay, with alcohol, remove this color and don't allow color to stay for more hours because it can have side effect also. But if you remove, then no side effect. Yes. So it depends. Sometimes when patient needs more, when therapist is handling, he knows that okay, I can keep 6 hours or 8 hours sometimes. But as for beginners, this is good to keep 2 hours. Yes, and then evening you can do seed therapy. Now this was lips. Now next is in mouth. As per Triorigin, we have tongue joint. This is tongue joint here. Okay. Now any problem in the tongue, redness in tongue, some you have to remember one thing. If person has chronic problem, chronic disease, then we are using red color. Okay, fire color. Just imagine fire, because this fire, this agni will help to fight with this chronic disease. If person has acute disease like tongue blisters, some redness, some inflammation. So in acute inflammatory diseases, yes, expansion, then in this case, you will put dark blue color. Okay. And in chronic means very old. In this case, you will put red color or orange color you can put. Okay. This is very, very important joint. Even patient has tongue cancer. Okay. You can start treating this joint. And this joint has in our Triorigin, this joint also has connection with immune system. Okay, so you can apply colors as I told you, and seed pattern is the same as I did it on the lip joint 4 direction. So you for seed therapy on Triorigin joints, we have 2 ways. One is check all points one by one. Yes, with patience, and wherever you find the painful point, you can mark, for example, here or here or here. And then on those points, you can apply seeds. Another way is if you don't find effective painful point or multiple points, or you don't find, then same technique which we have done here, we can do same here. 4 seeds, 4 direction, 1, 2, 3, and 4. So here 4 seeds, cover this every day for 6 hours. Any tongue disease, any tongue disease, start treating this with seeds, 4 seeds. Okay. And our rule is the same. To open mouth, again, I want to tell you, because results are very powerful. Even you don't have Triorigin consciousness, but if you follow this exactly, you will see the result. Right hand, thumb, top joint, put one seed here, see, one seed here on the yin yang line. This is yin yang line. Okay. After putting first seed, massaging and putting first seed, you open this finger, and on this middle joint, this is your tongue joint. All tongue diseases you can treat here. If you know the energy of the disease, then you can do color therapy here. Now we have color therapies, we have 6 key colors, we have Triorigin colors, we have Ayurveda color concept, yes, 10 origin colors. So your color consciousness, you can apply here. This joint is very, very powerful for treating all tongue diseases. Okay. As per your consciousness, you can do your color therapy. But if you don't have 6 key knowledge or 10 origin Ayurveda color therapy knowledge, no problem. You can do simple color, 2 colors or 3 color consciousness you can have. One is red, blue, green. Red color we are using in very chronic cases, and blue color we are using for acute inflammatory diseases, aggressive diseases, red and blue. And if you don't understand whether red or blue, the final color is green color. Okay, simple color. Many participants, they don't have color therapy consciousness. Color therapy is very big world. Rainbow color therapy, 10 origin color therapy, yes, like this, and Triorigin color therapy, like this. So if you don't have color therapy consciousness, then one color is very, very good, that is green color. Very simple consciousness with green color. Green color is symbol of prosperity. Green color has neutral energy. See, when you see the nature, this earth, yes, if you see from top view, maximum color, you will see green color. Yes, nature, green color. Grass all over, you see, you will see grass is covering the earth. If you don't maintain the land, grass will grow on its own. So this is prosperity, this is beauty, this is perfection. So now for beginners, those if you don't know color therapy, then you can keep one color in your mind, green color. But you should have consciousness, color of prosperity, Vishnu color, color of harmony, color, balancing color. So with this consciousness, you can apply green color in case you don't know which color. Yes. So this is mouth diseases. All tongue related diseases you can treat here. Also, I want to say speech problem also. This joint will help you a lot. Yes. If person suddenly loses speech problem, then here apply red color immediately, red or orange. Yes, immediately you will see the change. Okay, so this is very, very good color for speech also. Also tongue diseases. Okay, now next is this joint. This joint. This joint is related to gum and teeth. Any problem in gums or teeth, this joint will help a lot. any problem. You can take X, Y, Z in medical history. Gums or teeth. So now again the concept is, if person has chronic problem, yes, chronic problem, you will apply red color. If person has acute problem, then you will apply blue color. Chronic red and acute blue. Just a moment. Okay, and the technique is the same. 4 direction seeds. 1, 2, 3, and 4. So first step, whether you're treating lip, tongue, or gums, you will start first step from here. Yes, thumb, this joint, first point, seed, and then you can treat the joint as per the requirement. And if person has any problem in the upper palate, other part of mouth rather than lips, tongues, or gums, other part, you can focus this joint, this nail. This is called nail joint. So here also, yes, other part, yes, some saliva problem or some upper part, upper palate, lower part, and some problem in the inside, anywhere in the mouth. Okay, so this area is here again, inflammation. Yes, acute diseases you will apply around the nail, you can apply blue color. And a chronic problem, you can apply red or orange around the nail. And seed, you will apply here. See, I will mark for you this area. 1, 2, second seed, this one, you see 4. Okay, so fenugreek, methi, exactly. You will apply seed here. Four direction and 1 seed here. So 4 direction. Okay, and very good for other parts of mouth. Again, I want to tell that don't stop treatment in between. 15 days or 2 weeks continuously you will do, and you will see very good result. After that, if you feel that something is left still, you can continue after pause of 4 days. Give rest to our energy system, and then you can start again. And don't stop till the time you reach 100% result. In this journey, sometimes miraculous, as I always say, sometimes 4 days, sometimes 10 days, but even if you have if you see result in 4 days or 1 day, especially in chronic problem, don't leave your treatment before 2 weeks. Okay, now this is how you have to treat this mouth area. Then next we should focus esophagus. Okay, esophagus. This area is called esophagus. Sometimes inflammation here, sometimes cancer here in this area, sometimes muscles of this area is weak and it is very difficult for the patient to swallow the food. So this area, how you will treat this area? One way is very easy as per your correspondence system, that is in finger system. In Sujok, this finger system is called insect system. So in finger system, you see that this is mouth and this line, straight line, this is esophagus and this will meet the stomach area. Okay, so it means we have to focus from mouth, yes, from mouth to stomach. So if person has a problem in swallowing the food, okay, in this case, or any inflammation problem or any chronic problem, some ulcers or some muscle weakness here, yes, you have to focus here. So now when you see fingers, then in fingers, all fingers are representing your body. So these are all your representation of your body. Yes, your fingers. Now here is your stomach. So your esophagus means straight line. This is the area. So in all fingers, any esophagus related disease, any XYZ in correspondence system, we don't need to know the energy also. Yes, when we are studying 6 key or Triorigin, we should know the energy as per the disease. We need to study disease properly. But in correspondence system, we should know where is the disease. So, and where is the correspondent point of that disease. So why I'm drawing on all fingers? This is very important because in correspondence system, we need to find the most painful, if painful point, because you see, especially in chronic diseases, sometimes patient has cancer, sometimes patient has some chronic, very chronic disease, then we are not satisfied with just one application or one point. We need to find that which finger has multiple painful points. Yes, this is esophagus, and here also same pattern as we have made here, same lines on all fingers. Of course, here also, but this is little big, so better we treat, we focus finger. Now, after knowing the area of esophagus, then we should do very good. You can start with 2 fingers, and if you have less time, yes, then which finger is best? You can start with hetero finger. In our Triorigin, this finger is very active finger, and this is connected with heterophores, and heterophores has the most beautiful quality, that is change. That is why in sex system, finger system, we are using hetero finger and neutral finger, because progressive finger likes to change from, when we say change, it is, change means from illness to wellness. So that is why these 2 fingers have a very active vibration and has tendency to show change fastly. Okay, and then also we consider when we have time, we can check this finger also. So again, you see with the probe, any esophagus problem, one by one. Also, this is technique. And sometimes, uh, sometimes some people, they are finding painful point very quickly like this. Then they will miss the main point. This is not a good way to find the main correspondent point. We should have patience. One by one, I will show on one finger. Later you can practice, and on patient you can check these fingers also. So one by one, and in this journey, wherever you find painful point, you can put a mark. Don't put this line and don't draw on patient hand. This drawing I did for you. Okay, we can just put point, because we need to remember where the real point. We should not miss this point. So one by one, and we don't miss any point. For example, patient says, this is also painful. Then we put this mark. Like this, we go with patience. With patience, we go check. Slowly, slowly, we will check all this area. Once you have found the painful point, then on the point, we will do good massage. You see, first, my probe. With probe, I do two activities. First is find the painful point. Okay. After finding the painful point, second activity with probe, we have to do massage. So massage nicely, because initially we were just focusing in finding the painful point. Now, since we have found the painful point, now we will do massage. Because we have to discuss many diseases, so I will not focus, not give more time in massaging. This is understood. Yes. If person has any pain symptom, then just with massaging, these symptoms will reduce for sure. If the point is correct, then symptom will reduce for sure. Okay. So now after massaging this point also, we can apply black pepper. Especially in chronic cases, we prefer black pepper seed. In acute cases, we prefer uh, green lentil hara moong ki dal. We prefer that seed. And also like two seeds here. And also in one finger, we can find the painful point, and another finger we can apply chain of seeds on the on this line. This is esophagus. In a line. In camera, it is looking black, but it is green seed, green lentil. And white dot or eye of the seed will touch the skin. This is how we are treating esophagus. See, like this. Sometimes directional massage is also very helpful. For example, patient says, my food is stuck up in esophagus. Yes, I couldn't swallow. Yes, then directional massage means from mouth to downwards like this. So you do this directional massage. Immediately you can gulp and you can feel that your food is going down. And in here also you have this point. So you can massage this area like this. For massaging, this is very good. Esophagus. Okay. Now, I want to focus this meridian, stomach meridian, which can treat mouth and also which can treat esophagus for 6 key participants. Yes. Now, I told easy tips for beginners and for those who know 6 key. Now, as per 6 key, you have to focus this line. Yes. So in finger, this is yang side, nail side, this side. So we have 3 lines. We have 3 lines here. Yes. And also we have 3 lines on the front, 3 lines on the back. And when I told, yes, last time also, that distance between 2 lines should be equal when you see front and back. So this idea you should keep in your mind. So now I'm focusing. Imagine 1 line here, 1 here, 1 here. So this line, this is stomach meridian. Yes. So this line is stomach meridian. Here, I'm focusing this line. This line is very, very special line to treat all diseases of mouth until anus, mouth to anus, or we can say digestive tract, especially hollow organs, tubes. So this line is very, very good. Okay. So on this line, we have 6 dots, 6 key means 6 energy dots we have. And each dot has connection with the organ of digestive system. Now, if you want to treat mouth, yes, if you want to treat mouth, then in this, you have to first understand, yes, that is why this information is for those participants, those who have some idea about meridians. So, you see, this is the joint in your finger. This is your joint, and 1 dot, 1 point is here, and one point on this knuckle area. So first you should find these 2 dots, this one and this one. Okay. And then you see just below the nail, we have a point. Just below the nail, we have a point, 1 point, then second point, then again, when we divide this 2, we will find 2 points here. So we have to focus this kind of measurement. Yes, 6 dots. Because each dot is very, very special dot. Our hand is very dynamic. Each point on our hand is a wonder point. If with correct consciousness, with high level of awareness, if you just put 1 seed also, that can cover the disease. So for beginners, those who don't know 6 key also, they can start their treatment like this. For mouth diseases, they can just put here on this meridian, they can just put 1 methi seed also. This is step 1. If they can do step 1 also, 1 point here, and they can do that animal correspondent treatment. This combination will bring very good result. Just put 1 seed here and do that animal head system correspondent treatment for treating mouth diseases. Okay. Then after, yes, after now for 6 key. Okay, if you want to go little higher step, after putting one seed here, then this meridian becomes very effective for treating mouth disease, all mouth diseases. So we have, when we go branch level, then in this area, all these 6 points is related to, all parts of mouth, lips, gums, teeth, tongue, yes, and jaw like this. But we will not go detail. I just want to say, after putting one seed here, you can just do color on this meridian. Two color. This is very big subject, 6 key. But with simple consciousness, two colors or three colors, red, blue, green. Chronic cases, apply red color. Very acute, sharp, aggressive, inflammatory diseases, apply dark blue. And if you don't know, then with the neutro consciousness, harmony consciousness, we can apply green color. So after putting one seed here, this is mouth meridian, complete mouth meridian. 6 key. Those who know branch level, they can further do renting and can go next level. But for simple beginners, for simple treatment, you can do just this step for treating mouth diseases. After putting one seed here, this meridian will become active to receive mouth treatment. Okay, you can find the painful point here. You can do very joyful correspondent treatment here. Yes, if you don't have 6 key dots knowledge, check with the probe this area. Wherever you find the most painful point, you can treat there and you can finish your treatment. So this is one way to treat mouth 6 key. But Triorigin, as I told you, this was Triorigin approach. This was Triorigin approach in treating mouth diseases. This is 6 key. Yes, simple 6 key approach. This is not, that sub branch. Just simple approach because I'm teaching from beginner's point of view. This is one way. Okay. So if you find this is simple, you can do this. And also if you find this is simple, you can do this. But I want to recommend, along with this treatment, you can add one Triorigin treatment. This is very, very good approach. 6 key also very good. If you have very good 6 key consciousness, then this is also very good. Now, next is this meridian. As I told you, after putting one seed here, this meridian, now we will see full view of this meridian. After putting, I want to say again, after putting one seed here, this meridian will become mouth meridian. And in our science, we say gallbladder meridian, or we say Ah wind or Yang wind meridian, representing the mouth. So in both hands, this middle finger, middle line is mouth meridian after putting that first seed. In female mouth problem, treat, work on right hand. In male mouth problem, you work on left hand. Okay, colors are very, very effective if you do it with your correct consciousness. Okay, and then here, esophagus. Esophagus, as I told you, this is very, very good treatment. Very, very good treatment. Additionally, yes, you can also add Triorigin treatment. Now this is Triorigin approach for esophagus. Sometimes combine, if you can understand, this is very powerful. Triorigin treatment for esophagus. Okay, now see. Right hand. Now you see right hand here, you will put first seed. Here. Just a moment. First seed, this is first step. You will put first seed here. So, sorry, not here. I want to check. That was mouth problem. Please pay attention. Thumb, lower joint. And here you will put first seed. Fenugreek seed. One seed. So means here. See this joint? And it is finishing here. So you will massage, and you will put first seed. This first seed is very important in Triorigin world. After putting first seed, then in middle finger, previously you remember we started from here. Okay, so please keep this thing in your mind. Now we are focusing esophagus. For esophagus, we have to start our journey from the lower joint. Then in middle finger, this joint, we say hetero joint. Here, second step, we need another step. Second step, this was step 1. And this is step 2. So this is step 2. So second step, here, one seed. For most difficult disease of esophagus. Don't worry, you do it. Of course, your medical doctors, yes, you will stay under observation of medical doctors. At the same time, you do this treatment and your doctor will also see the change. But especially I'm talking about even very severe cancer related, if it is initial stage, you will see very quick result, very, very quick result. And all diseases of esophagus. Step 1, this one on the thumb. Step 2, as I told you, this step. Yes, you will focus here. And then after doing this second step, index finger is your esophagus. You see in our hand, multiple points are there. And each point has a story behind. That is why you see many, many discoveries. Already discoveries happened because these points already creator has created. This is a very wondrous repair system in our body, a miraculous system in our body. Yes. So in this right hand, Again, for esophagus, step 1, in the lower joint, on the outer side, on the yin yang line, you will put first seat after doing massage. 1, 2, 3, 4. And the second step, in middle finger on the outer area. You see this side towards the ring finger like this. Here, massage on the yin yang line, you will put second seat. According to Triorigin, this joint, complete this joint is digestive system joint. And this point is little part of digestive system. This is all digestive system related points here. So this small point is esophagus point. So when we press this point, or with perpendicular needle or with seed, yes, then after you treat this point, your index finger will become very sensitive to receive esophagus treatment. And after this step, this is very, very important step. This finger is esophagus, ready to work on the esophagus. But if you don't do this, then this is just index finger. But when you do this point, then this finger vibration will change and will connect this. After this point, this finger will connect to esophagus. Whatever treatment you give here will go to esophagus. Okay. So now after this finger is opened, now this finger, as you have studied in insect system, there are various ways to treat this finger as per the level of your consciousness. For beginners, they can just simply do insect system. After doing these 2 points on the insect system, they can just work, because this complete finger is esophagus. How you can treat? Either you treat with insect system, that line which you have just understood, okay, or on the joints. On the joints. So if person has any acute disease, you work on this joint. If person has any chronic disease, then you work on this joint. Okay. And if you don't know acute, chronic, or combination, then we work on the neutro, this joint. I'm not taking Triorigin name, otherwise we say this is hetero joint, homo joint, or neutro joint. I'm simplifying for you because beginners are here. So this joint is for acute diseases, this joint is for chronic diseases, and this is for all moderate diseases, or when we don't know whether acute or chronic. Another way is that if person has very severe disease of esophagus, then we should give time. Okay, then in this joint, then try to find the painful point one by one. Finding painful point on the joint is the same. We will not leave any area of this joint. Now, once again, because pressing, it should not be very deep. It should not be superficial level. You have to press and try to understand that is this pain a routine pain, or is this pain a sharp pain? Okay. When this point patient says, this is very strange pain, sharp pain, with moderate, little more than moderate. We will not say moderate pressure, little more than moderate pressure. And then you can put a mark so that you don't lose the point. And you can check all joints. You can check all joints if you have time and patience. This is very good. You check all points. And then on those points, if you're acupuncturist, you can put perpendicular needle And if you are not doing needles, then you can put seeds. Yes, you can put seed on the painful point. Okay, so this is how we can treat esophagus. So now you know, yes, how to reach mouth, how to reach esophagus. Okay, and you will do treatment for 2 weeks for sure. You can add more days also, but why I'm saying 2 weeks? In 2 weeks, every passing day, you will see improvement in patient condition. Sometimes we start treatment, sometimes in chronic cases, you will see that treatment sometimes in some patient can show late response and we give up. No, you should not give up. You have to be very confident because this is very good approach, Triorigin approach, and it will definitely show the result. Sometimes late, sometimes early. Okay, so if in 3-4 days you don't see any change, still I will say don't stop, continue. Chronic cases, sometimes there are like very homo, they will show change little late maybe. So we don't give up and we continue, we don't give up. Okay, now
Excuse me, ma'am. This is 10:01.
okay.
Actually, we
Okay.
have to answer to Chanda sir, no, if we have
No.
continued the session.
Okay.
So I think we can stop the session now, ma'am, and we'll continue in the next class.
Okay, fine. Okay. Okay.
Because you're
So
already
if you have any question, okay, we can continue. So if you have any question, because I wanted to focus each point minutely. My aim is to that you should get result. That is why I don't want to jump. Okay. Now, if you have any quick question related to our present topic, you can ask, and we will continue.
Hello, ma'am.
Hello.
If there is any decay in the wisdom tooth, is that also healable?
Pardon once again, please.
Decay in the wisdom tooth, can you help the patient?
Pain?
Yes, pain in the wisdom tooth because of decay.
Yes, you can, of course. So in your thumbnail, you have to treat. You know the point now. Yes. Last. So in this thumb, mark central line, and near the central line, try to search the point. Okay. Horizontal central line, and then near central line, you try to search the point.
मैम अगर मुंह में सलाइवा कम बनता है तो क्या करना?
Saliva. Okay. Then you start treating in Triorigin, if you remember, middle finger, the nail area. And one thing I want to say, tonsils, I will tell next.
अभी चुप रहो, मेरा आने वाला है.
Yes. So also I will say, if you do mudra, like mouth disease, this nail. Yes. When you do meditation, you do this mudra, keep your finger like this and you will feel saliva. You will feel saliva in right hand. So don't forget left hand and right hand.
Thank you.
we can go for one more person, that is Anushree.
Yes, please. What is the
Anushree,
question?
please. Anushree Mota.
Yes, ma'am. Can I start my video?
Yes, please.
I want to show you something.
Yes, please.
But okay,
Yes.
ma'am. You can see my lip, tongue.
Yes, I can see.
So you have shown that middle joint of the finger.
Yes.
I put methi dana there.
Yes, you can put methi dana
Or red color.
Yes, or and also red color, and in your meditation try to do this mudra.
This mudra.
Yes. Yes,
In
if you
both
can
hands.
do, yes. No, in right hand this is very powerful.
Okay.
And if you can do 2 times, 3 times, yes, one time you do with meditation and other time you can do just even watching TV and anywhere you do this and you will see the changes in your tongue.
Okay. With the meditation, how many? मतलब,
Yes,
कितना
in
time तक करें?
meditation means when you are very calm and relaxed mind. Very
Okay.
relaxed mind, even before sleeping, when your mind is very relaxed and you
Yes.
are about to sleep, you do keep this thumb on your tongue joint and
Okay.
to sleep like this. And also for all diseases, lips, tongue, saliva, I told you. Yes, saliva, nail, and gums, you keep this.
Gums के लिए ऐसे and saliva के लिए ऐसे.
Gums के लिए middle joint, saliva के लिए nail.
Nail. Yes. Yes.
Yes.
Okay. Okay.
And yes.
Ma'am,
और
the chat box.
in both hands. In
Right
both hands.
hand, right hand, I will tell what to do in left hand, but please follow the rule, right hand, because in left hand we have other points. Right hand, you have to focus for mouth, right hand, middle finger.
Okay, thank you.
Ma'am, last question from the chat box. That is, one person got an infection in his throat and inner ear.
Where?
In throat and inner ear. Infection. Inner ear, inside.
Okay. So now throat we have not discussed, we will discuss next time. But now if you have infection now, so what you can do, this is in this area we have Vishuddha chakra. So here she can put blue, dark blue color, and here on the other hand, she can put black pepper seeds. Yes, and in tonsil area, see my drawing, I will show. Here you have to put, you can put black also. So you can see here. In one hand you put black color and on the other hand you put black pepper. Black pepper actually, why I say, though it has spicy quality, but it has medicinal property also.
क्या हो रहा है क्या अभी तक? देखो ना खोल के. डरना किससे है?
Okay.
Thank you so much, ma'am. Thank you. You're
Don't
covered.
worry if you have questions, because you see we will finish our digestive series and then if you have questions we can have one full session
For that.
and answer all your questions.
Sure. Thank you so much, ma'am.
So I will not leave anyone, don't worry. This is
Yeah.
full session dedicated to this.
We are covering all the Sujok levels to treat for each and every diseases. Thank you so much, ma'am. Thank you. Actually, we don't have any words to give.
No, please. You see, my mission is that they take result, and when they will get result, this is blessing for me.
We know that you already completed one batch course. No, after that you're coming here to give some knowledges also. So wonderful.
It's my pleasure. I'm so happy. And we will have one day after finishing some session on digestive system, one day fully dedicated to participants' questions.
Yeah. Thank you all participants. Mild thanks. And we will continue the session whenever she got time. She
Yes.
got a free time. She will
Soon we will have, stay connected with the group. You will get information about next session.
Yeah. Thank
See
you
you.
very much. Thank you very much. Thank you all participants. Smile night. Special thanks to Chadda sir. Okay.
Thank you, ma'am.
Thank you so much.
Thank you, ma'am.
Bye-bye. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
Thank you very much.
Thank you, ma'am. Good night, ma'am.
Good night.
Thank you, ma'am.